Good morning, everybody. This is Vicki Bird. I'm a registered nurse and the CEO of the Montana Nurses Association, providing you with our weekly legislative update. So to start off with, we have developed a SWAT team, Special Workforce Advocacy Team, and currently we have 27 members who have volunteered to participate on that team. Our staff has held 2 legislative training sessions for that team. We had one in the morning and one in the evening, and there was great attendance. This advocacy that you guys can join the SWAT team. We provide all the talking points, the tools, the training, the legislative process, how you can call legislators, email, testify, all of that. So we give you all the support that you need. And what's nice is you can participate remotely because Zoom is being utilized at the 2021 session. So if you're in Sydney, Montana or Hamilton, Montana, you can participate, but we will prep you and provide you with all the information that you need to do so. So please consider signing up. Just email Sheila at mtnurses.org and you can find all this information on our website. The first legislation I want to highlight is House Bill 168. This is a right to work bill that targets public employees. We, of course, vehemently oppose that. We've also asked our SWAT team to provide testimony on that, which some of them have. They can either call their representative or senators or email. M&A has also submitted a formal testimony on that and has requested to participate via Zoom because we're still continuing to advocate for masks and social distancing. So if they have Zoom available, that's how we're going to participate. So we really will oppose any right to work bill that services this session. Also of note, we're doing a quick cleanup bill for our APRNs. Often in the statute, it still says like physician or physician only when it is something that is within the APRN scope of practice. So we're not expanding anybody's scope. We're just kind of cleaning up the old language, you know, that for many years, physicians were the only ones that could provide primary care, and our APRNs for now over 40 years can provide independent and primary care. So we're going to advocate for a super cleanup bill on that, and we'll let you know more when that comes to fruition. Additionally, which is super important to our members, I believe, is M&A is working with Representative Cafaro to add a COVID-19 as an injury, as an occupational disease under workers' comp. This is going to help with those long haulers or those that have long-term issues that contract this disease, you know, while at work. And we're hoping that workers' comp will treat that like any other occupational disease like hepatitis or HIV or tuberculosis. So we will, right now it has a LC number 2451, and when that becomes a House bill, we'll let you know what that number is and then encourage our SWAT team and any others to reach out for support on that. We are also having a great discussion regarding violence against nurses and healthcare workers, which we've tried to bring every session, as many of you know, and worked so hard when we launched our Your Nurse Wears Combat Boots campaign. So we did hold a town hall this past week, 2 different times, and we put out a petition. This is super important. We need the nurses to sign this petition. It's just simply directing M&A, our staff, to continue to pursue, which we always will, no matter what, violence against healthcare worker bill, some enhanced penalty, some attention, and bring that up that this is a real thing that nurses experience. So we're hoping that many of our members just simply sign the petition. It takes a couple minutes. And then we can go back to those lawmakers with 500 or 1,000 signatures and say, this is still on the top of minds of our nurses across the state. So please look in your home emails. It has to be your home emails to converse with M&A and sign the petition. Also, we're monitoring for a healthcare resolution and a PPE for emergent use resolution. A healthcare resolution that's lifting up nurses and healthcare workers. So of course we will support that, and any emergent resolution to support more PPE and the proper tools for us to do our job. In the advocacy realm, we have on our website a new advocacy tab, and under that tab is just going to be ongoing advocacy that M&A does whether we're in session or not. An example is I met with Charlie. He is Governor Gianforte's new health policy advisor. to discuss the needs of nurses in Montana and what M&A as an association, who's been here for 109 years, what those needs are, and that we're here for Montana and we have been for over a century. Also, M&A wrote letters to Montana's congressional delegation, asking them to consider increased federal assistance under HRSA, especially in underserved and rural communities of Montana. So it's fast and furious, this legislative session. I encourage you to get signed up for our SWAT team. All the information is on our website, www.mtnurses.org. Thanks, everyone. We'll see you next week.